Let's react to Facelifts Are Ruining Your Face by Miss Hansen.
If you've spent any time on social media recently, then you know that the word on the street is that Christina Aguilera is looking really good lately. Jessica Simpson looks absolutely unrecognizable. She literally looks like she's 22. And Kate Beckinsale, she literally looks like she's 18 again. How do they do it?
Maybe it's just good skincare, or maybe it's something else.
The first time I ever saw those new videos of Christina Aguilera, tell me why I thought it was AI.
Well, it might be AI, right? I mean, sometimes people are modifying their images that they post online, and that could be with Photoshop, it could be with different AI tools. There are many posts that are created by celebrities that have slightly modified images or videos of themselves. So that, of course, is happening. And at the same time, some celebrities undergo different procedures like plastic surgeries that also change their look. And oftentimes they're not open about what it is that they did. And that is frustrating to many of us. And many people feel that there should be more transparency in this industry.
While some reporters on social media claim that these women are actually not the real deal and that they're clones, which is actually a very scary thought, but I am not here to talk to you about that today.
I don't think cloning technology has advanced quite to that point yet.
I'm here to tell you the damn truth. If any of you are aware, Miss Christina actually didn't look anything like this a few years ago. In fact, this is the version of Christina that I remember very clearly. A little bit of overfilling, a little bit on the curvier side, and she certainly does not look as ageless as she does today. Look at her!
Yeah, some of it has to do with like this filler fatigue phenomenon that we were noticing over the past 5 years, that people are starting to use a bit too much of the HA filler product, and it was making the face just much more swollen and bloated and starting to distort people's natural anatomy. In addition, over the past 5 years or so, as people have started to take more and more of like Ozempic and other GLP-1 agonist medications, the face has started to slim down, and with the dissolving of HA filler, there's now this kind of expansion of the skin and sometimes a sagginess. So to combat that, there's been a trend over the past year or two towards more facelift surgeries, and sometimes for younger and younger patients, to try to offset some of the effects of those GLP-1 agonists and of prior filling.
And the secret, everyone, it's a facelift. Allegedly. Okay, don't take me to court. But yep, I said it. Yes, it is more common than ever in today's digital era seeing women as young as 25.
Oh wait, is that me on the left there? Oh, I see myself. All right, cool. Thank you for including me in this video.
One of the most invasive plastic surgeries, the facelift. And today I'm exposing every detail. Everyone, let's buckle up because we're going on a wild ride. A facelift, also known as a retidectomy, is designed to reduce the appearance of wrinkles and sagging skin on the face and the neck, creating a more youthful appearance.
A retidectomy. So basically, a rytid or a ritid is a wrinkle on the skin, right? So it's almost like a misnomer because we know now that to improve the wrinkles on the face, usually you need some form of skin resurfacing, like a laser treatment or a chemical peel, or just a good old, retinol and good skincare to improve those wrinkles. But a facelift usually will address the deeper tissues, and it can reposition those tissues and put some of the deeper structures into their more natural positions, and then excess skin is essentially removed. In the past, it was thought that it would get rid of all the wrinkles, but usually a facelift is not enough to improve the actual skin texture and quality. There are other things that one does to improve those wrinkles, but the name that was originally given to the procedure still persisted. So we still discuss it in technical terms as a retidectomy, but most people know it as a facelift.
Though there are many writings of ancient practices involving early facelifts all the way from Egypt, Rome, and China, the very first documented facelift occurred in 1901 by Eugen Hollander. The procedure involved lifting and trimming loose skin near the cheeks and around the mouth to create a smoother, rejuvenated look. This facelift was quite minimal compared to modern techniques, focusing primarily on skin tightening rather than the deep layers of the tissue and the muscle. The field of cosmetic surgery, including facelifts, really grew in sophistication throughout the 20th century, now focusing on deeper layers of the face to create a more natural and lasting result.
In particular, the focus is on the SMAS, the superficial muscular aponeurotic system. This layer is closer to the surface of the skin than the actual muscles that control the movement of our faces. But this layer, when repositioned, allows for those deeper structures to be set in a more original position. And in order to reposition this very important layer, one needs to get through the ligaments that are actually anchoring these tissues in place. In the past, these ligaments were often not addressed and not released, but now we have an improved understanding of the anatomy, and we know where we can incise and disrupt those ligaments to allow for a safe and effective repositioning of the tissues.
At this point, they're pulling everything that they can get their hands on to get that snatched, youthful look. Emphasis on snatched. Now, you might look at the incredible results that Christina Aguilera has had from getting a facelift, and you might think it's just a cute little walk in the park with your boyfriend, holding hands, drinking a PSL.
Well, no.
Facelifts are probably one of the most invasive plastic surgeries that I've researched thus far.
And again, this is why I caution the overuse of facelifts, in my opinion, for our younger patients in their 20s and 30s. I think that this is a more invasive procedure than many others in aesthetic cosmetic surgery, and it should be reserved for patients who are a bit older, in my humble opinion.
The human face undergoes many changes as we age.
Facts.
The skin becomes thinner, loses fat, and no longer looks as plump and smooth as it once did. Years of ultraviolet sunlight exposure makes the facial skin less elastic, while gravity causes the skin to sag and wrinkle. A facelift can smooth out the facial skin sagging and wrinkling, in particular, the jowl regions and the sagging upper neck.
Remember, some of those deeper wrinkles can be improved with a facelift, like the marionette lines or the nasolabial folds. But there are those finer lines and wrinkles on our face, and some of those are better addressed with Botox, and some of them are better addressed with things like laser resurfacing, such as with the CO2 laser, for example, or various types of chemical peels. But great skincare is also equally important to keep the skin as hydrated and as healthy as it can be. And I want to make sure that all of you know about my brand, Feel Confident. We have amazing skincare and hair care of the highest quality at still affordable prices. And that is something that we stand for. We want you guys to have the best ingredients, but not have to pay an arm and a leg for some of these legacy companies. Instead, you can use Feel Confident skincare and hair care to look and feel your best. So make sure to check it out.
When it comes to facelifts, intimate knowledge of the different layers of the facial skin is essential.
Ooh.
Immediately below the skin is the subcutaneous fat. The fat provides volume and smoothness to the facial contour. Next is a thin fibrous layer known as the SMAS, which stands for superficial muscular aponeurotic system.
And that's exactly what I was talking about previously.
Remember the SMAS.
It is a key facial support structure that the overlying skin rests on. Finally, the underlying salivary gland, muscles, and nerves are present. First, the facelift incision is made hugging the ear boundary and hairline.
Those are very important nerves that actually control the movement of our face. And that's part of the reason why it can be a very tricky operation. Because as surgeons have started to go deeper and deeper into the face, they're at a higher risk of encountering some of these important nerves and vessels that live deeper in the face. Most of the nerves that innervate our facial muscles innervate those muscles underneath the muscle. So when you're just working right under the skin surface, that is a safer plane to generally work in. As you start to get deeper and deeper, your risk of encountering one of those deeper nerves gets greater and greater. In experienced hands, the risk of nerve injury is extremely low, even with deep plane surgery. But as more and more people flock to do these surgeries because of the increased interest in them, of course, the overall risk in general for all people getting these procedures goes up, because now they're not doing the safer type of surgery that's just under the skin surface. Instead, people are going into these deeper planes where there is a higher potential for problems.
Skin and underlying fat is lifted off the SMAS layer. This skin undermining is performed all the way forward to the eye, nose, and lip, as well as downwards over the upper neck. Strategic incisions are made to the SMAS layer.
The skin is not always undermined to that degree. Many people believe in undermining less, and sometimes just to where you're about to make that deeper incision into the SMAS,
which is then elevated off the underlying facial muscles. Next, the freed SMAS layer is then pulled both upwards and backwards.
Bro, this is not fun and games. This is not no quick little booty injection. They are ripping your face up in shreds. It is a construction zone.
Please note that the areas immediately around the eyes and lips are not improved with a facelift, and require other additional procedures to make them appear more youthful.
Well, it's not that they don't improve them at all. There's definitely the potential for some additional movement of the lateral eye up and back. There's also the potential for the lip corners to appear less droopy with the deep plane facelift. It's not guaranteed that that's going to change, but there is the potential for that. But of course, some people get complementary procedures such as various brow lifts and blephs and lip lift surgery to address concerns that are not fully included in facelift surgery.
That's crazy. You need to get subcategories of facelifts just in order to get the full snatched effect. It's not just going to work with a classic traditional facelift.
And there's also varying degrees of neck work that's done. Typically, a facelift implies some degree of a neck lift as well, but there's also deeper neck surgery that can be done to address some of the deeper fat, some of the glands, and excess muscle that can exist in the neck region.
We're gonna get to all of the different options you have, baby. They literally cut into you and snatch your muscles back.
And also, because of the incisions that are made up here by the hairline, some people end up losing some of that hair. So then they come to people like me who do a lot of hair transplant surgery to place the grafts of hair into those scars to improve those regions to make it look more natural.
You've been drooping for a minute, we're gonna pull you up out of the gutter. But I guess it all makes sense because if you're simply pulling the skin on top, it doesn't actually target the root issue. Those videos of that animated woman really do not show you the intensity of this procedure, so let's look at what happens to a real person. Day of surgery, epic facelift 3-week update. No, you guys, she looks like she was in a brawl.
Yeah, and you can see also some incisions for the lip lift that was performed. I can also see some incisions for the upper blepharoplasty. Most likely a lower bleph was also performed. And I even see some markings for a brow lift as well. Many surgeons will offer these more comprehensive packages for addressing the aging face. And that can include work in the upper part of the face as well as the middle third and the lower third of the face. So it's not like the facelift is often done in isolation. You have all these complementary surgeries that then of course carry quite a bit of healing time and downtime post-operatively until you look and feel more like yourself. So that process of recovery is not for the meek, right? So it can be difficult for people to, look at themselves in the mirror because they went in trying to look better and then temporarily they, of course, look worse before they look better. So there are high rates of depression that occur during this recovery stage, especially in the first few weeks. And that's something that's often not discussed, but I think it's very important to think about as people consider getting this type of work done.
She is so bruised and so swollen. It seems like those tiny little incisions and all that seems so simple, but it is incredibly invasive. Look at it, it's only getting more swollen. My goodness. After 3 weeks, she did look truly incredible. She was actually unrecognizable that first week. That was crazy.
These surgeries can be quite transformative, and when performed in the right hands, they can be quite safe and overall a positive experience. But again, you have to make sure you know who you're choosing as your surgeon and make sure that they've done a lot of these, that they have a good track record with the surgery, because it's definitely not a minor procedure.
It just goes to show you how swollen and sore you probably are after all of that cutting. Here is another before and after. So you're looking at her right after the procedure. You can see how pulled tight she is. And now we're seeing the before image. Baby butt smooth skin. Look at her face. People typically end up getting back to work within a couple weeks of their facelift. However, you have to be on complete bed rest. Otherwise, honestly, the worst could happen. Like, don't move, don't speak, sleep on your back, be very, very, very careful with your face. This is your face, you guys. But for the entire face to heal, all of the swelling to go down, it can take upwards of 6 months.
It can even take longer than that. Sometimes it takes a few years for all of that swelling to fully come down. Because remember, sometimes also fat transfer is performed with a facelift, and that's actually removing some fat from, say, the abdomen and injecting it into the face. That brings also longer recovery times of more swelling, but it can also improve the quality of the skin because fat tends to carry some stem cells, and that can help in part with regenerating the skin.
Now, the perfect candidate for a traditional facelift is someone who has sagging or loose jawlines, a large number of wrinkles and deep creases, drooping or hooded eyes, sagging facial muscles. And now when you think think of these symptoms, we typically imagine somebody in their 50s, 60s? But no, in 2024, there has been a massive boom of specifically young people undergoing facelifts. So this begs the question, did Christina Aguilera actually get a facelift? How can you show a picture of you at 18 versus being in your 40s and look literally like time didn't pass? People truly believe that she looks better than she has ever looked. This is like, I can't go on my For You page without hearing somebody talk about Christina Aguilera and this amazing transformation. Now, would you believe me if I told you that Kylie Jenner allegedly has also recently undergone a full-blown facelift at 27 years old? Are we okay? What?
And I've said this in prior videos, but I think one of the biggest concerns with younger and younger patients getting these more invasive procedures is that they will likely need more and more surgeries over time to maintain the look. And what that does is that it increases the risk of these various complications from facelift surgery, because every time you go back in, there's more and more scar tissue that forms and that is there, and you're trying to work through it surgically, but it can be a challenge to find those proper planes when you keep going back, right? So maybe you were fine the first time or the second time, but as you go in for round 3 and 4, there's now a lot more scar tissue and it's harder to navigate. So I think we will see a rise in the complications that occur from these surgeries being done on younger and younger patients as they keep coming back for more and more.
My belief, based on this photograph, that Kylie Jenner has had a facelift at the age of 27. Why do I think that? I'm a plastic surgery enthusiast, and once you know the signs of facelift, you can't unsee them. This
the
is
ear.
The ear right here.
The
I don't
ear.
know if you can see the pull here. Those are the telltale signs of a facelift. You saw in 2020 that Kylie was looking very full in the face.
It is really hard to completely restore the tragal area, which is what they're talking about, to its original preoperative state. You can almost always see some differences. They were talking about the pull, but also as the skin is redraped back and excess skin is removed and the whole area is tailored down at the end of surgery. And sometimes as the skin heals and pulls the tragus forward, you can get what's called a shotgun appearance to the tragus itself. And those changes, even if you don't see an actual scar, can be quite noticeable. Also, as I frequently talk about in my videos, you can often see that some of the sideburn hair is missing after these surgeries. Where did it go? You know, it was removed with the excess skin that was also taken with it. So again, one way to combat that would be to get a hair transplant down the road. But as far as the tragal changes, those are very difficult to adjust in the future.
There's a lot of people that have openly talked about and discussed, specifically online, that they are not doing any sort of facial fillers and they're going to wait for the premium moment to get a facelift at 50-something years old. Do you? First comment, I'm telling you guys, do a video on the signs of a facelift. I'm so glad I never dabbled in filler. My goal is straight to the facelift. Same with Adriana Lima. If you check her recent pictures, she 100% had a facelift, and it's very visible because of the pixie ears. Pixie ears? That is kind of cute. So Kylie recently went to an award show, and after seeing that, I was slightly skeptical in terms of the idea of a facelift, but at this award show, there were all these pictures, and oh my god, you guys, it is she doesn't look the same. It is a full-blown facelift at 27. These pictures that I've seen on her Instagram, I had to look and I stared and I zoomed because my goodness, she looks like a porcelain doll. Everything that somebody had to say about her face previous from those fashion shows where she was missing the filler, she has gone, oh, you don't like me? I'll change it, no problem. It makes me genuinely sad.
I think there will be a time when the pendulum will swing back towards doing less. And I think we've seen that in the makeup world where some people just go makeup free. I know Pamela Anderson did that for some time, but I think we'll see that also with cosmetic plastic surgery. At this point, it seems like people are doing a lot, at the max, more invasive procedures at younger ages, right? But I do think that as we see more complications coming to light and we just have, a different collective discussion about this as a society, I do think we'll see less and less of it being done, especially at younger ages. But as I talk about in my video on Millie Bobby Brown, there's a lot of pressure on young stars to look their best and to try to please the masses, which I think they quickly learn is impossible because people always have something to say. If you look great, but you had a facelift or you had some other surgery or even just had injectables, they'll say like, oh, you're fake because you had this done. But if you don't look your best, or you're starting to look a little older or a little bit more tired, they'll point that out too. So the best, of course, is to try to be, happy in your shoes and to be content with how you are. But that's difficult to do too.
How much she didn't want people to talk about her looks. Don't talk about me. Why do people feel like they need to talk about me? When she literally morphs into a new person at every single event. She changes herself left and right and up and down, and all of these trends do have a genuine effect on other women. People are gonna wonder, how do you look like this? I feel like because of Kylie Jenner and definitely the Kardashian movement and how they've glamorized work, plastic surgery, and fillers over the past few years, we are moving into an era where those who were influenced, who did decide to overfill, are now choosing to remove that sagging skin with a facelift in their 20s.
Here's why I think we'll be seeing a lot of early, subtle facelifts in 2024. And it has to do with the beauty trends that were popular in 2023.
Exactly.
Those being buccal fat removal and medical weight loss. I will say it again, facial fat is good fat. With the rise of these two trends, we're losing fat in our face.
I have pretty strong opinions on buccal fat removal, so make sure to check out my video on that topic.
And that can lead to premature aging. Fat in our face is supportive, especially in our mid-face. With rapid weight loss, we see flattening of the cheeks, which leads to deeper folds below. With buccal fat removal, we're losing some of the support in our lower face, which can also lead to jowling down the road.
Bro, I've lost a few lbs, and honestly, I can see it so clearly in my face. I feel like instantly it makes me look older, and I'm like, do I gain the weight back? Like, what do I do?
Celebs were the leaders of these two trends, and that's why I think we're going to see them going for early, subtle, quiet facelifts. I'm already seeing more chatter about these mini lifts that are designed for younger people, less invasive.
Yeah, the whole idea of a mini facelift is also often a misnomer in that there's nothing too mini about them. If they're performed in the deep plane style, they're still a very invasive procedure, and they might be called mini because the mid face, for example, is not elevated as much, but usually the lower face is included and the neck is included with a mini facelift. But again, every surgeon defines a mini facelift differently, so it's more important to find out what's their actual technique, what's their plan of execution for you when it comes to your facelift, rather than just saying that, oh, well, I'm just going for a mini facelift. It might make you feel better about the fact that it's mini and it's not a full-blown facelift, but you have to realize that it probably is a full facelift, and maybe they call it a mini or a weekend lift or a, just a minor facelift or micro facelift, whatever the terminology someone uses to market their procedure. You do need to do your research to understand, well, what exactly will they be doing during that procedure, and what kind of recovery is that, and where will my incisions be? Those are all great questions to ask your surgeon.
Facelift in your 20s or 30s is insane. Tell me about it. You're definitely right. Check out Lindsay Lohan recently and her facelift. Oh my God, that is so true. Do they think we don't notice?
Yeah, they do.
This young man went and got a full-blown facelift at 27. He was also somebody who was a victim to the overfilling, and I just cannot believe the work that he got done at such a young age.
All right, so facelift. Oh, Dr. Gary. That's me right here. That's cool that she included me. Thank you. At 27. That is young. Oh, whoa, things look quite pulled there.
Oh, that's elevated.
They're gonna settle. This is crazy. This is like a little surreal. It's like a reaction to a reaction to a reaction. It's like Inception. That looks quite exaggerated. His brows, I would argue, were in a very
Oh my. Without the filler, bro, can we not agree that he looks good? Why did we have to do that? Take me out.
Natural position to begin with, and they were already quite lifted. So for
okay, you guys, we were almost hitting that egg girl face. You know what I mean? Like with the egg girl fillers in the cheeks. Like that is kind of crazy.
It was a good idea to go in there and lift the brows to this extent.
It's lifted.
I think is problematic, in my humble opinion. And he also had a full facelift, it seems, and they dissolved the filler. So there's a point where things just are overdone, and I think he may have reached that. And also when people are getting these larger plastic surgeries at this age, I think it's problematic for the future because that will limit how many more times a surgeon can go back in there safely.
Just looking at those videos, I cannot believe how
I still believe that.
absolutely intense a facelift is. And more than anything, I would be so worried if anything went wrong in a procedure like that. Now, I know this facelift thing looks like a lot, but I mean, I think all of the options are relatively intense. Like, there's no such thing as an easy peasy facelift. So like that previous video, she mentioned there's something called a mini facelift. Sounds pretty easy, right? Like a more non-invasive facelift, because you know, at 27, we just have so much extra skin to deal with, right? Now, even though it sounds like a great idea, apparently a mini facelift is just where the doctors do half the work and you get half the results.
Don't fall for this scam in plastic surgery. The mini facelift is one of the biggest scams in plastic surgery.
Dang.
Yep, I agree with that 100%.
Mostly because the term mini doesn't actually mean anything. It's a marketing term that basically makes it easier for your surgeon and shortchanges you on an actual good result.
Truth.
The incisions are almost exactly the same. There are some modifications here, but a mini facelift doesn't mean less incisions. Big chance for deformities like this one here. It's called a sweep deformity.
Oh my.
Pretty much what most surgeons call a mini facelift nowadays is the skin-only facelift lifts of the past, right? So when it was just like going under the skin and undermining a little bit and pulling back and removing the extra skin is what most surgeons will actually call a mini facelift these days. Or you can call it also a subcutaneous lift, but it's basically where you're not doing a deep plane. But other surgeons call a mini facelift a deep plane facelift that is only releasing some of those ligaments that I mentioned earlier. They're not releasing all of them. They may not release, for example, the ligaments that allow you to pull the mid-face back, but they'll release some of the lower ligaments, and they call that a mini facelift. But that is still a deep plane surgery that still carries those same risks that we talked about.
Oh my.
Tissue's not supported properly, you can end up with something like this. And mini facelifts don't release that deeper layer called a SMAS.
But again, some surgeons are releasing at least part of the SMAS and calling their surgeries mini facelifts. So it's very surgeon dependent. So you have to do your homework and you have to see what exactly does that surgeon consider a mini facelift.
So I guess it's sort of like a band-aid fix. I fell for the scam and I regret it and paid so much. I should have just done the full facelift.
You know, and then people are confused by like, well, what is a full facelift versus just a facelift, right? It's confusing because there's, of course, the face, but classically, as us surgeons talk about a facelift, we're thinking about the middle part of the face and the lower part of the face. We're not really talking about like the brows so much. We're not talking about the eyelids. That's usually addressed with separate procedures like a brow lift and upper and lower blepharoplasty. Those can be combined with the rest of the facelift, but when some patients think full facelift, they just assume that all those things will be included. So please talk to your surgeons and make sure that you know exactly what's being done and what is being included for your surgery.
If you're still getting cut open and then you're not even getting the full result, why would you opt out to do something like this?
Is it worth getting a mini facelift?
Mini lift is a trend, exactly the same as threads.
Well, it's not exactly like threads. Threads is a whole different technology and procedure. You know, a mini facelift is still a facelift. I wouldn't put it in that category, but I do think that it's sort of a trend. It's basically like a marketing tool, similar to what the last surgeon was saying in the clip.
So they're asking for the mini facelift, and some doctors say, yeah, of course, I will take your money, create a scar here, pull a little bit of your skin, and you will be happy. The real thing is you will be happy for 6 to 9 months.
Are you kidding me? 6 to 9 months?
I guess he's comparing it to a thread lift because usually you don't get much more improvement than 6 to 9 months, you know, out of the thread lift. So I see the comparison there, but it is still a very different process.
When you still have to do all of that healing, all of that downtime, and then it doesn't even last?
And then sometimes the scars actually heal worse because there's more tension on the closure. The nice thing about the deep plane approach is that you're putting your tension on the deeper structures, similar to how I do my L-lift lip lift, where I place the sutures in a very deep position where I'm anchoring the SMAS and I'm not tethering down the actual skin surface or the dermis itself. And it's the same thing for a deep plane facelift, where once you anchor the deep tissues, the excess skin that's hanging over gets trimmed, and then there's very little tension on the skin itself. And so the healing is usually much better. And in my practice, I use our Feel Confident Scar Gel to optimize the results of surgery, especially surgery done on the face. The matte finish of our Scar Gel is, I think, one of the main things that sets it apart and makes it unique, because soon after starting to apply Scar Gel, you can easily put concealer or makeup over top, and it's not going to be that kind of shiny appearance because of the matte finish of the Scar Gel. That's one of its benefits, but there are others, so make sure to check it out.
All the results will be gone because the real facelift need a proper dissection to pull back all your structure back in place, like your deep layers, like the muscle, the smooth muscle, the deep fat compartment and everything. This is a real work. And at the end of the day, it's the same scar. It's just the scar here. So if you do a mini face or a real facelift, it's exactly the same for you. Same scar, same downtime.
All right, so I guess that one's off the table. Now, like mentioned there's also something known as threads or a thread lift. In a thread lift, very thin, tiny, dissolvable threads with little barbs on the end of them are inserted into your face with a needle. Honestly, it's grossing me out.
By the way, these threads are just suture material. So they're usually like made up of PDS material, which is a very common dissolvable type of suture that's used. I used to use them for lip lifts, but I switched over to monocryl, which is a more gentle type of deep stitch. But a thread lift is just using PDS in the form of like a barbed type of thread suture.
The barbs or the cones that are on the threads hook into the skin tissue, allowing the surgeon to pull and lift sagging skin into a more youthful position.
And remember that these thread lifts are often done by non-surgeons. So people who are just like doctors trained in aesthetics are probably in some places not even doctors. So that is something to consider as well. Most plastic surgeons who specialize in facelifts do not offer thread lifts, and that's because they tend to not last. So that is just one of those things. I don't think thread lifts are super popular, and I don't think they're going to gain popularity because the results are very short-lived.
I think like the thread off your t-shirt when you're like, let me just yank that off. Over time, it's also mentioned that these threads stimulate collagen production, which does add volume and skin texture.
Part of the stimulation is really just causing scar tissue. So in that sense, you get more collagen, but it's disorganized collagen.
Now, as awesome as these sound, they apparently only last a year and they can look botched.
Well, anything can look botched. So you can get dimpling of the skin, but you can also get that from a facelift. So again, I don't know why, but a lot of times people aren't discussing the actual risks and complications of facelift surgery. So I'm going to have to do a video to address that.
Watch until the end to see incredible results. Look at how they are inserting them with a big needle and the thread comes no.
But you see the bunched up skin has like nowhere to go, right? So because no skin is being removed. So as that starts to work itself out, it tends to just go back to its original position. And with these thread lifts, none of those ligaments that we discussed earlier are being released. So really the tissue is temporarily shifting into a new position, but then it's very quickly returning into its original location.
I mean, the snatching has been snatched, but honestly, watching that really does make me sick. Like, you guys, we're not dolls.
But we almost never see long-term results of threads because they don't exist, for the most part. So you might see these immediate results that look impressive, but why don't we ever see, before and afters of 1 year later how it looks? It's rare to see because, again, the results don't often last.
Now, I found this TikTok where this girl is talking about how much she loves the threads that she put in her cheeks, but I couldn't help but notice the comments. Do not do threads. It doesn't last and the sagging gets worse once it wears off. It never lasts with PDO threads. Best to just invest in the surgery. So happy you had a good experience. I paid $1,700 to have the worst trauma of my life, including nerve damage. Yours look great. Well, that's not very convincing. I don't know if I like those reviews. There have been a lot of clips circulating online of Kylie Jenner and other celebrities where when you turn your head as well, some of them, you can see the threads under the skin, and it is this very odd pulled look. It just does not seem like a good idea. Let me know in the comments down below if you guys want a full deep dive on threads. I have done partial research understanding this, but I had no idea there was a black market underground threads division. I need to investigate.
There's a black market for everything, people are buying their own fillers and injecting themselves at home. So, there's all types of stuff that goes on.
Now, moving on, there's also something known as a ponytail facelift. I think from the name you can already tell what they're up to when they give you that ponytail look. Allegedly, this is what Bella Hadid has undergone to create that beautiful fox eye lift that she's got going on. Like, it always looks like she's got a really tight Ariana Grande top of the head ponytail going on.
The ponytail facelift, which is a mini deep plane facelift that has your scars and your hairline, you can literally be at dinner the next day. Amazing, I know, right?
Wait, that's insane.
I mean, not really. There's still recovery that's associated with it. So people aren't usually going to dinner the next day. They're at home recovering.
Bella Hadid, allegedly, she has had a ponytail facelift, which means she's lifted all of this.
So again, those incisions are made behind the hairline out here in the temple area, and usually there's no skin removal, right? Especially because this is done on younger patients that don't have a lot of excess skin. But when there is excess skin and you need to remove it, well, guess where you're going to be removing that skin? Right here at these incisions. You're not going to be able to remove the skin all the way up here. So that's something that a lot of people don't consider, but you can only do these ponytail type facelifts on patients who don't have much skin access. And when you have a little bit of skin access, well, then you can get away with a short scar, right? Sometimes only in the back or only in the front. But as you have more skin access, well, now you have to extend your incision to resolve that excess skin that needs to be removed, right? The incision essentially elongates the more skin you have to remove. And the elongation of that incision is what leads it to then wrap around the ear. If you have a very small incision and you try to remove a lot of skin, you're going to have a lot of bunching and what we call dog ears in plastic surgery.
When you're younger and you move your tissue up, you're creating a new face shape. And that's what gives her that almost elf-like, they call it fox.
Because your incision is going out here into this temporal region, you can oftentimes get the lateral eyebrow and lateral canthus to lift in part with the release from that incision. And that's how you can create that fox eye look if that's what you're going for with that surgery.
Just like a lot of plastic surgeries, this is a very clear trend. Like the whole fox eye effect. I have seen so many women undergo this procedure and it is very dramatic. It is very intense. And is this really going to be the look in the next 5 years? I'm not sure. Somebody from the future tell me. All of these facelift types share the common goal of restoring a youthful appearance.
And it's not like you can easily reverse these appearances, right? So people get this permanent work done, and then if they're not happy, they're essentially stuck with it until there's enough aging, and then you can decide what you want to do next.
Which is crazy to think that anybody under the age of 40, 50, 60 would have any of these issues. Now hold on to your chairs because facelifts cost anywhere from $10,000 to $15,000, with rumors of even this ponytail facelift costing $30,000.
No. It gets a lot more expensive than that. I mean, some of these surgeries are going for upwards of $100,000, sometimes $200,000 per procedure. This is, of course, with surgeons that are actually operating on some of these celebrities. And if you want to go to one of them, then you're going to be paying, hundreds of thousands of dollars. So the upper range is quite high, much higher than what she's reporting here.
Which is insane.
And then, of course, some people go to places like Turkey or Mexico or other countries where they still, offer facelifts, but at reduced prices, right? Because not everyone's looking to pay this much for a facelift.
But wait, I have a way cheaper and easier option for you guys. If any of you guys have been watching my channel for any period of time, you know exactly what I'm going to tell you. In plastic surgery, there's always this sneaky non-surgical BBL, non-surgical rhinoplasty, or in this case, a non-surgical facelift. This is where doctors or nurse injectors will give you the effect of a very invasive plastic surgery, such as a rhinoplasty, with something called dermal fillers.
This filler that she's about to, talk about, and that's like the liquid facelift, but it's just the filler of, what people were getting in the past that was leading to filler fatigue and those bloated faces. It's not to say that no one should get filler. I mean, filler in smaller quantities and done tastefully and properly can still be effective. But I think most have moved on from these very elaborate filler sessions of dumping 10 to 20 syringes of filler into the face and thinking that that was a good idea. We know now that that filler is very hard to get rid of eventually, even with trying to dissolve it with something like hyaluronidase. And it tends to migrate and it tends to attract more water over time and lead to an even more bloated appearance that can get worse and worse.
And you guys already know how I feel about fillers. But now this is more suitable for people with mild or moderate signs of aging, and it provides a quick and relatively low cost option, but of course it is far less effective, way less. And not to mention the fact that Botox is a neurotoxin, and also fillers in general, they never dissolve. They end up causing pillow face if injected incorrectly. In my opinion, most of the time they look very unnatural and also could potentially cause vascular occlusion or skin death. 7-syringe mini liquid facelift. Properly placed cheek, chin, and jawline filler can look natural, adds beautiful structure/definition, and creates the illusion of a more lifted look.
Filler results like this are the reason why some people call it a mini liquid facelift. In her after photo, it looks like I'm taking my hand and just pulling her face up. She looks more defined, sculpted, and lifted.
Sure, it looks fine, but tell me you're not going to get addicted and go back in 3 months to get a little top up on your lip filler. More please, sir. More filler, please. I'm hungry. But this is something called necrosis, which can occur if you do have dermal filler injected into a blood vessel.
But you see, like, we know about these complications, right, on the internet. People have talked about it at length. They've shown different examples like these of vascular necrosis and various other complications of facial fillers. But what about examples of nerve damage after a facelift or of a massive hematoma that can occur with a facelift? We often don't see enough examples of that, even though it happens, right? Or infections that can come from facelift surgery. So I think, again, the more we're exposed to that on the internet, the more the pendulum will swing a little bit further away from facelifts, especially at younger ages. And again, it's not to say that facelifts are bad and no one should get them. Of course, facelifts have their place, and it can be an extremely effective procedure when done safely and properly, as we've seen with some of these recent examples, of celebrities getting this type of work done. But they still come with a real collection of potential risks and complications.
It can cause blindness if you put it around your nose or your mouth area. And here this girl got lip filler and ended up with skin death on her upper lip, which is very, very scary.
In many ways, when I performed fillers in the past compared to facelift surgery, I always felt a bit more comfortable and secure doing the actual surgical approach rather than filler, because I felt like at least I could see all the tissues. And something like blindness is I've never heard of that when it comes to facelift surgery, but with filler, sure, there have been documented cases of that. So again, each approach has its own types of complications and risks, and one needs to weigh them carefully when making a decision about what to do with your face.
Now we've arrived at this part of the video where we have to discuss the pros and cons of the facelift. Why we should maybe think twice before spending $10,000 just to get our faces cut
or $100,000
open and yanked to the back of our skulls just in the name of beauty. One of the main reasons is it's kind of just like getting veneers. You spend all of this money for the veneers to only last 10 to 15 years. The facelift is no different. You spend all of this money to go ahead and get a facelift, and they only last 8 to 10 years maximum. Then you got to go back and get another one?
Well, listen, nothing is permanent. That's just the nature of us being human. So yeah, sometimes people don't get another one, and sometimes they do. So it just depends on how their face ages. It depends on the quality of the original work. So there's a lot of factors there.
Now, there's no harm done if you choose not to go ahead and get another facelift after that 10-year mark. The signs of aging will just resume and your face will begin to go back to the way that it was before, which sounds so sad, like spending $10,000 just for those results to fade away. At least with the rhinoplasty, you got that new nose for life.
That's not necessarily true. There are a lot of aging changes that can occur with the nose as well. Noses tend to get a little bit more droopy. The skin tends to sag a little bit. Sometimes you just get a rhinoplasty and, the nose was straightened, but then over the course of 10, 20 years, you can start to see some of the asymmetry and some of the crookedness come back because the cartilage has some degree of memory, and that can also occur. That's often something that's not discussed. But of course, if you've taken down a hump, you remove that bone, the bone's not going to completely grow back. So there are certain effects that are more permanent and other effects that may shift and change as we get older.
But the reality is that we actually cannot stop aging ever. It is inevitable. This is why getting a facelift in your 20s and 30s is so insane. You're gonna go get another one in 10 years? Bro, that is so scary. I'm gonna look like that little head guy from Beetlejuice. Don't even get me started. We're all going to look like Cher. My cousin got a facelift at 27. That's way too early. You guys, that would be if I got a facelift right now. What are they lifting? Sure, I got an 11 going on. Well, for me, it's not an 11, it's just a 1.
And it's not like in 10 years, you're going to start to see the changes in your face, right? Changes are going to start to occur much sooner than that. So let's say you're 27, you get a facelift. By 28, 29, even if the facelift is performed really, really well, you're going to start to see that there will be some changes. So even if you see the slightest bit of laxity developing, I'm not talking about jowls, right? But like even just a little bit of laxity, some people, especially at that age, will feel like, well, that's not acceptable. I need to make sure that I'm lifted again. So I've seen some patients in my practice who nowadays I don't offer the facelift at the moment, right? Because I'm so focused on hair and lip surgery, which is what I really love to do. But some patients who come to me for hair work, they're getting these mini facelifts almost every year. Can you imagine that? So every year they go back for a little tightening. They're playing with fire each time, right? So then they're coming to me looking to get some grafts placed back into their hair along where the scar is. But meanwhile, they keep tightening it up with some facelift surgeons, right? And so I don't know. It's not just like they're getting it every 10 years. Sometimes they're getting it every year, which is interesting to think about.
And how invasive it actually is, it creates a huge risk for skin necrosis or skin death and even infection.
All right, so now we're getting into some complication risks. Good.
Skin necrosis occurs when blood flow to the skin is compromised, causing the skin to die and often leading to scarring and really discolored skin on the face. This is a woman who had skin death after her facelift, and you guys, it is not pretty. Like, it looks so bad. And that amount of scarring, what are you going to do? And if you aren't taking good care of yourself and on bed rest immediately after the surgery, this scarring can be crucial and it can ruin the entire result of this facelift.
And most of that scarring has to do with the actual technique more than the quality of the patient's skin or what they did exactly in the postoperative period, even though those things of course matter. But just like in my hands now with lip lift surgery and hair transplant surgery, most of the results and the quality of the work is what's actually done during the surgery, right? The caliber of the surgeon and the surgeon's team, that really is the biggest driver of the outcome and results and whether someone gets a complication or not. However, there are always going to be some risks of these procedures. And then of course, what the patient does in the postoperative setting matters. The way that they heal, of course, also matters. Some people are more predisposed to something like hypertrophic scarring or keloid formation, or, let's say they have a thyroid problem and they just don't heal as well. That, of course, will also contribute to the healing process, and that might change the degree of scarring that they're ultimately left with. Or if someone has, for example, diabetes, right? Like if that's not properly controlled before surgery, they might have some wound healing problems. So it's very important to know the person's medical conditions, if they have any, and if they're well controlled, before jumping into elective cosmetic surgery.
This client came to us in hopes of permanently concealing the scars left on her face.
That's
facelift.
Awful. So she's getting the scars tattooed to try and cover up those scars. You guys, this is your face. And just like that doctor said, you have literally one face forever. You need to be so careful with who you trust. After a lot of research, I started to realize that a lot of times in a facelift, because it is so invasive, there is a huge chance for complications in general. So it's not even really about what complications arise, but when, because you never know what could happen.
I've heard of patients, going to some of the best facelift surgeons and still ending up with, real complications. And it's not that the surgeon messed up or anything like that. It's like there's always going to be some, underlying risk. And no matter how hard you try, no matter how hard the patient tries post-op, these things can happen. So I think people really need to be informed about this, and they really need to weigh the pros of the surgery against the potential cons.
Do we not think that by selling a mini facelift or selling a facelift as young as you can go, in your 30s and your 20s, are they not making more money? Because then you have to continue to go back.
These facelifts are going viral on TikTok. There is a doctor named Dr. Kim
What is
who posts
happening?
a lot of his before and afters of facelifts. Thing is, his patients afterwards look nowhere near recognizable.
And I've done a video reaction to this specific patient before.
They look completely different. It also has to be noted that I think he's taking these videos and pictures of them like directly after surgery, or maybe like a week after. So they're still rather swollen. I don't know, maybe it is the desired look. Maybe it's like, let's pull the skin so tight so we don't have to do it a second time. But these results do look a little strange.
And that's the thing, like some people are looking, 20 years younger as far as their face goes, but like internally, they're not necessarily getting, healthier. The rest of their body isn't necessarily, going through these same types of massive changes, or maybe, they're getting a full refresh. But when you have people who are, 70 years old looking like they're 40, is that good for society? I don't know. I think that's something that is worth discussing, but, should we be looking like a completely different generation of person, or should we be looking age appropriate, but, refreshed as can be, but still age appropriate? I don't know how everyone feels about this, but surely when I do, for example, hairline designs, I'm thinking about what is appropriate for this specific person, taking into consideration, their age. I think that's okay to do. So when we lift people, and do all this very extensive work, and now they look 20, 30 years younger, is that a good idea? Should we be doing that? Just something to think about.
It's just a perfect example to go to a plastic surgeon who creates results on other people and the type of results that you want for yourself. You ultimately have to do a ton of research to decide where you want to go. And also making sure that that plastic surgeon takes really good care of you and keeps you safe in case any of these complications arise. Now, because they're working on the face, they're pulling the muscles, they are around the nerves. The nerve damage thing is like pretty serious. Nerve injury can result in facial weakness, drooping, or loss of sensation, particularly around the cheeks, mouth, and forehead. It's stated that these complications are temporary. However, the people that do experience them, it's stated that the complication of nerve damage can be temporary, but some patients report after getting a facelift, they are unable to smile or close their eyes.
Well, it can be temporary or it can be permanent, right? Sometimes nerve damage can recover, and sometimes it is not recoverable, and you need additional surgeries to correct that nerve injury, right? So it just depends on that specific scenario. But that is definitely, in my opinion, one of the scariest things that can happen with a facelift. And when I used to perform facelifts, that was definitely one of the biggest things that I was always afraid of.
Although it is typically rare when working with a very skilled plastic surgeon, this is why it is so important to do your research. Just like any plastic surgery procedure, this is one to think very long and hard about. The facelift has been around for a very long time, and they are constantly perfecting it. However, it seems like a bit of a stretch for somebody to undergo such an intense and invasive surgery for those results to only last 8 to 10 years. With all of those risks too, and then taking those risks every 10 years to maintain this facelift, it's crazy. For me, at this point, it's kind of like a one and done. Like at 60, one and done. At 60, am I gonna care? I don't know. Facelifts are what they are. They've been around for a very long time.
Yeah, I think definitely facelifts are not some sort of a trend, right? Like she said, it's been around for a long time. It's not going anywhere. It will be, offered for, I don't know, as long as we're human. Facelifts being done on patients in their 20s and 30s, I think is a trend, and I think will be something that fades over the next, 5 to 10 years is just my guess, but we will see.
And there has been such a history of women that are older that decide to undergo this procedure, and there's absolutely nothing wrong with that. What bothers me so much about this facelift trend is that people who are undergoing this procedure in their 20s and 30s, it is only instilling this idea into ourselves that aging is not okay. That aging is a horrible crime and a disease, and we need to nip it in the bud and do it really early. And that we're not even really able to enjoy the pleasure of maturing and growing older without feeling as if we need to constantly be looking younger and better. But younger doesn't necessarily mean better. Why does somebody that is already so young need to strive to look so much younger? And what's even more insane is the dishonesty behind these transformations. Kate Beckinsale does not like people feeling sorry for her, and she's usually quick to let them know. When fans expressed concerns this year about her appearance, she accused them of insidious bullying. Anytime I post anything, I'm accused of having an unrecognizable surgery, using Botox or fillers, or being obsessed with looking younger. The 51-year-old actress wrote online, "I don't actually do any of those things." By being dishonest and saying, well guys, it's not Botox or fillers, you're not doing us any favors. You're not blessed or special by not getting work done and being so secretive about it. There's no harm in doing something for yourself and then just being honest about it.
Yeah, I think there was a time when gaslighting, everyone was okay, or was very difficult to tell, or, people didn't know, or people couldn't communicate that knowledge to the rest of us. But I think nowadays, with as easy as it is to get a video out there and for people to very clearly see these changes, and then for the celebrity to still continue to say that, hey, nothing happened here, it just seems a little bit silly. And I think that will change. And I think it's good to talk about, why they elected to do those procedures. I think that will help society sort of, just come to terms with how we perceive beauty, and, how we think of the aging process and of each other, and how we treat each other based on, our looks. I think all of that is healthy discourse, but it's hard to start that conversation when the people who are sort of at the top, these celebrities that we put on a pedestal, are not willing to be honest. Let me know what you guys think in the comment section below.